Hello, friends, and welcome back to Rarely Typical, the podcast where I am talking about living with a chronic illness, finding hope, and what it looks like to live a life that is rarely typical. I'm your host, Gerry Langan, and I'm so excited to deep dive today on a topic about medical gaslighting, my experiences with my own medical gaslighting, how that created trauma and PTSD, and all of the stories that we tell ourselves because of the things that we've gone through. So, like every time, in order to talk about where I am now and all of the things that I've learned, we have to go back so that you can understand where it was that I came from. When I was diagnosed in the state of Colorado, and because my husband is in the military, right after my diagnosis, we got orders to move to the state of Alabama. And because I had just started treatment, I had only been on the pump that I started for about 2 weeks before we moved. So not only was I dealing with a brand new treatment, I was also dealing with having to find new doctors and understanding what it looked like to transfer care from one doctor to another. As somebody that is often never sick up until this point, I did not know what I was getting into, and I did not know the things that I know now looking back. I wish that I had been guided a little more into how to find a specialist and where I could go for specialized care. At the time, I was just surviving. So when we initially got to the state, I decided that I needed to go ahead and find a specialist. My doctors in Colorado recommended a specialist, and when I was looking at how far it was going to be to drive, we were actually going to be driving about maybe 4 hours to see the specific specialist. Because of where we were, I could have driven 3 or 4 hours out of state and gone to a different clinic. But at the time, I didn't know that my insurance could even go across state lines. I did not understand how insurance worked. I did not understand that I could go to a clinic in Georgia or a clinic in Florida and I would have just done the same thing that I was doing. But what you don't know is what you don't know. So I started seeing the specialist right off the bat when I got there, and she cut my stitches out early. I had just had a tunneled line placed, and not even 2 weeks later, she had cut my stitches out. And she told me that she was great and she was getting her center accredited. And because of that, I was going to be in great care. And I left that appointment feeling fine. And I was excited that I was going to be with a doctor who knew what she was doing. And then, not even 24 hours later, I got a phone call from a specialty nurse. So, not even her nurse, a specialty nurse telling me that the doctor called the specialty pharmacy, told them to call me and tell me that she made a mistake and that she cut my stitches out early, and that for the next couple of weeks, I think 4 weeks, she recommended that I not bend over because my line just might fall out of my chest. At the time, we had 18-month-old babies at home, and that was literally impossible. It was the most traumatizing event, I think. I was just like, if the stitches are the problem, like, there's no way that this is gonna be medical care for me. There's no way that this could be okay, but I didn't know, and I felt uncomfortable saying, "I think I need to go see somebody else if this is the care that I'm gonna get." And I talked to my doctor in Colorado about it, and he was like, "If you need to go somewhere else, absolutely do that. Just call and reestablish care, and we will send over a referral." And he encouraged me to go find new care, and so I did. And I started seeing a new clinic, and the new clinic that I started seeing had a team of 6 doctors. And what that meant was that every time I went in, I had a different doctor, whoever was on that day. And sometimes they knew my name, and sometimes they came in and didn't even know who I was. And there were instances where I would go months and I would get a doctor who came in that I had never met before. And so establishing good care was really difficult, I think, in hindsight, because I wasn't seeing the same person. They did not know who I was when I got there. And most importantly, they were not a specialty clinic. At the time when I started going to them, they were classified as specialized doctors. However, they were not an accredited center. And I, as a brand new patient, had no idea that there was a difference. And so I thought, as a specialized doctor, they must be an accredited center, right? But like, I just didn't know that there was a big distinction there. And so I started seeing all of these doctors, and there were a couple of doctors in the group that I really connected with, and I was very thankful to have in times that I really needed them. But there were also times when medical conversations in my chart got lost. There was a lot of miscommunication because there were so many nurses, there were no specialized nurses, and I was seeing cardiology instead of pulmonology. And a lot of the nuances of pulmonary hypertension got lost when you are talking to a cardiologist who looks at hearts instead of a pulmonologist who is looking at the pulmonary hypertension. And just because they were specialists did not mean that they understood everything about my disease. Every time I had an issue, I would call, and there was a lot of confusion about how important the information I was giving them was. There was a lot of confusion about what the big deal was sometimes, and I started feeling like I was crazy, like maybe I was being a very difficult patient, and I thought maybe, maybe I'm just being too much, and that tends to be my personality anyway, and I'm very self-aware of that. So I know that I can be a lot for people, and I thought maybe I'm just being one of those patients that is crazy. So I started seeing them, and there were a lot of instances where things went awry. And I kind of just excused them because I didn't know any better. One instance, I had pneumonia and I went to an urgent care and they were like, "You have pneumonia." And I told them that I had pulmonary hypertension. And thank God that the nurse and the doctor from this urgent care actually went to the church that we went to in Alabama. And she was like, "Oh, we will get a CT scan. We will look at your lungs. We will make sure that everything's okay." And she went above and beyond the care that I was getting at this specialized clinic that I thought I was at. And I'm so thankful that she reacted right away, because when I called my doctors, they were like, "Oh, you'll be fine." And, fast forward a couple weeks and I went into clinic and I told one of the doctors that I actually had a good relationship with, I told him that I had pneumonia and he was shocked. He had no idea. And it was in my chart. It was in the portal messaging. And he was like, "If I had known, I would have had you come in right away because that's like a big deal." And I just didn't understand how it was possible that kind of communication could get lost between doctors and between nurses to doctors. So, if you are listening to this podcast and you've heard me tell that pneumonia story before, the reason that I think it's important to tell is because it was such a small issue that should have been easily taken care of. And that led me into all of the other issues that I was having. And since this is a podcast, I'm going to tell you about those things. There was another instance that I had with this team of doctors where I had an infected line. And if you've been following me, if you found me because you follow me on Instagram, you have seen the pictures of what this line looked like. It was like my chest was black and bubbly, and there was like no way that it was normal. But you don't know what you don't know. And I had never had a tunneled line before. I'd never had my skin react this way to anything before. And I told my doctor, like, "Hey, like, this is what's happening. This is what it looks like." I went in multiple times and they looked at it, and many times they told me it was fine. And, my husband and I look back at it sometimes and we are like, there is no way that was normal. And it was crazy that we thought that, but we were being told by these doctors that we believed were specialists that my line, which where my skin was black and bubbling and oozing, was normal. And they told me there was nothing they could do about it. And when my line got infected, I ended up in the ER because I was septic the first time because we let it go for so long. I had been started on oral antibiotics that did not help. and it just kept getting worse. And I just kept being on oral antibiotics and it still wasn't helping. And they told me it was fine and that I should wait until my next appointment when I came in, even though I was on these oral antibiotics. And so I ended up in the ER because I had to call 911 in the middle of the night at 3 a.m. because I was shivering cold and I could not get warm and I knew something was wrong. And when I got to the ER, they drew blood work and they ran cultures and they said, "Hey, we think that you're septic and we need to get you to your hospital immediately." So I had to take an ambulance ride 4 hours to my clinic. When I got there, they were like, "Oh, it's really bad." And I said, "Yeah, like I've been trying to tell you that it's bad and you have been ignoring me." And they're like, "Oh no, there's no way we would have ignored you." And then they looked back into my calls and my messages on the portal and they were like, "Oh, we're so sorry." And then when they went to pull the line, they looked at it and I had a Hickman catheter, and if you're in the medical field, you know what I'm talking about. But this medical team did not know what I was talking about. They looked at it and they were like, "Ooh, what is that? We've never seen a line like that before." And my first thought was, "Oh no, I have made a grave error." And I was just like, if you have never seen a catheter like this before, I don't know if I want to be here. But at the time, I was so sick, I really didn't have another option. And so when they went to pull my line, they were like calling other people in to have them look at it because they had never seen it before. Like they were using me as an example of what a line looked like that they had never seen. And they had multiple people come in and look at it. They wanted to ask me about it. When they pulled it, they wanted to look at it. And I was just like, what is happening? This is a very common catheter. And the fact that this hospital that is supposed to be specialized does not know what it is was shocking to me. But then, you know, my stay in the hospital, I was there for a very long time. I was very sick. The sepsis was very bad and they treated me for a long time. But while I was there, I had to have IVs in my arm in order to get the medication to my system. And I blew 6 IVs while I was in the hospital. And I was so upset because they kept trying to put these lines in me and they kept blowing my vessels because they were trying to push medicine in some and then also pull blood work out of some. And I got one right in my thumb, right where my wrist meets my thumb, and it was brutal. And when she put it in, it was so funny because if you have a chronic illness, you know that somebody hitting the vein is like a dream. She was like, "Oh, I'm like one of the best at this. I can do this." They went and got her because she was like so good at like placing an IV. When she placed it in my thumb, I immediately started crying. And she was like, "Are you okay?" And I was like, "No, I'm crying. I'm obviously not okay." And she was like, "It'll be fine. It'll stop hurting soon." And I couldn't even move my hand. Like my hand went numb because I think she had it in a freaking nerve. And of course, the line blew within the first blood work getting pulled from it. And so after that, I was talking to a different nurse and I was telling her that I had 6 IVs and she was like, "Do not let them draw blood from your IVs anymore because your blood vessels are not holding." And she was like, "I don't know why at this point they have not put a PICC line in your arm, but you need to ask for that and I will put in the order for it." And so they put in the order for this PICC line and they had so much pushback that I did not need this PICC line. And I was so confused because I had never had this many IVs before and they had all blown. They didn't have anywhere else to go. They tried all of the places in my arm, and I was like, "I will not let you put another IV in." Like, I had to find my voice after all of this time in tears and say, "You cannot put another IV in my arm. You have to put a PICC line in." And I had the doctor come in and they were like, "Why do you need a PICC line?" And I'm like, "Listen, lady, You have blown 6 IVs. You cannot do another one. I'm in pain and I'm already dealing with all this other stuff. You have to put a PICC line in." And they finally put in the order. They came in, they put a PICC line in, and then not even like an hour later, this lady came in and wanted to pull blood work. And she wanted to pull it from my PICC line. And I said, "Absolutely not. They just put that in. I will not have you blow it. You can just stick me." And she was like, "You would rather get stuck than for me to pull it from the PICC line that's already there?" And I was like, "Yes, absolutely. I refuse to have you pull blood from another line in my body and have it blow. You can just stick me every time." And she was like, "You want us to stick you every time we need blood? That's gonna be a lot of sticks." And I'm like, "Honestly, at this point, couldn't even care less." So I was traumatized, and to this day, I still stress when someone wants to put an IV in my arm. And so this leads into all of the other crazy stuff that happened. There were so many crazy things that happened when I was there, but, like, some of the biggest ones have changed, like, who I am and, like, what I advocate for. And so if you've been around for a while, you know that I'm a huge champion of everybody getting a second or a third opinion if you need it. And being a patient for the first time, I just didn't realize how important it was that I got a second opinion and how huge it would be for my medical care and also my life when I needed a second opinion. After I had my central line placed, I went home. My second central line that they placed got infected, obviously, because they placed the new line on top of the infected old line. And so my skin was still infected and got into my new line and caused another infection. And this time I knew what I was looking for. I went to the doctor immediately and they had to pull that. I had gotten so much better on the IV medication that we had a conversation like, "This IV is not working for you. Your skin is not able to tolerate this. We believe that you are better because your numbers are so much better that we think that you could come off of the IV and just go to an oral medication." And I was like, "Oh, cool. That's awesome. That is genuinely answered prayer." I had gone from severe to mild. I was no longer in heart failure. I was reacting very well to the medications. And they were like, "Yeah, so we think that because now you are cured, we don't need to put you on this medication at all. And we can just keep you on the 2 oral medications that you're on and take you completely off of this IV." And in the little itty bitty amount of research that I had done and remembering what my doctors in Colorado told me, that this was a lifelong illness and that this was a lifelong medication, I was like, "I don't know if that's accurate." And they were like, "What do you mean?" And I said, "I think this is a medication that I should be on forever, right?" And they're like, "No, you're better." And I was like, "No. I mean, yes, I am better, but I'm not cured. There's not a cure for pulmonary hypertension unless I'm confused and all of the research online is confused." And she was like, "I think that you're better and that you don't need to be taking this medicine anymore." And so when this conversation happened, I was still in the hospital and I was like, "I'm not sure how I feel about that yet. So I need to take some time to think about it." And she said, "Okay, we'll be back." And she left and I called Colorado and I said, "Hey, this is the situation. Can you give me a little guidance?" And they were like, "Absolutely do not come off of that medication without replacing it with another medication. You cannot just come off of this med. They cannot just take you off of it." And I was like, "Okay, I was sure that this was sir." However, it made me feel better to hear it from another person who actually was in the field and doctors that I trusted. And so when that doctor came back to the hospital room that I was in, I said, "Hey, I needed a second opinion." So I called Colorado's team and they said that I need to stay on the medicine. And she looked at me, and I will never forget this. She looked at me in the eye and she said, "If you need a second opinion, then you need to get a new team because you don't trust us." And I think I was so stunned at the anger radiating off of this woman that I had the audacity to go and ask for a second opinion. And I said, I think it's my right to ask for a second opinion. And I need you to speak to the Colorado doctors and do what they are recommending. And she told me that I did not need a second opinion because they also were specialists and knew what they were doing. And I said, no, I really think that I would like you to do what Colorado says and do their plan. And she told me that I needed to find a new clinic. Let's just say her and I did not end on very good terms because I did start on the medication that Colorado recommended. They started me on a lower dose than Colorado recommended. It's actually in my chart that I was a difficult patient at the time in Alabama because I was asking for the second opinion and that I was being very adamant that I should stay on medication. And I started on this new medication right before we moved to Florida. I went in to close out my clinic experience with them, told them that we were moving, told them I needed new care in Florida and that I would be needing them to send my medical records, all that stuff. And I went in hoping to see the doctor that I did like a lot. And I got the lady who told me I didn't need a second opinion. And I went in and I was like, yeah, I'm moving to a new clinic. I need my medical records sent over there. And she was like, I hope you have a better experience there than you did here. And I was like, honestly, couldn't be any worse at this point. And she was like, it would have been better had you not been so difficult. And I just was shocked, y'all. I was just like, the audacity of this woman. And I was like, I am going somewhere that is a center of excellence. And I am so excited to be with a team that knows what they're doing. And she said, I didn't trust her anyway. So it didn't matter what she had to say. Have a good life. And I was so mad. I left and I was furious. And that is my experience. And I hated it. And it was so traumatizing, and it made me self gaslight because I thought maybe I was crazy. Maybe I was being difficult. She was telling me I was being difficult. She was telling me I didn't need a second opinion. And who am I? Like, I don't have medical training. Maybe I was being crazy. Maybe I was being difficult. And the trauma that I experienced there created PTSD that I still have now, which is so insane because it's been so long. But, like, that kind of trauma is not easily overcome, especially when you are still seeing doctors all the time. I think as people who are chronically ill, and especially when you're young and chronically ill, and especially if you're a woman and you're young and you're chronically ill, we deal with a lot of things that look like medical gaslighting, that look like medical negligence. And we are so often quick to say, oh, must be me. Especially as a woman in today's society, we are so quick to blame ourselves or we're so quick to apologize when really we should be asking more questions and not apologizing. I am a big proponent of asking for a second opinion and not letting somebody talk down to you just because they have a degree. And we are so quick to self gaslight when someone is medically gaslighting us that it becomes this perpetual problem where when you go see a doctor and a doctor tells you you're being crazy, you think to yourself, oh, I must be crazy because that's what they said. And that's not accurate. And it's a long lasting trauma and it causes this PTSD for medical professionals. And it puts a strain on your care and it puts a strain on your ability to take care of yourself when you are thinking to yourself, like, maybe it's me, maybe it is my anxiety, maybe it's me, and maybe I'm fine. Even when you're not fine, you're clearly not okay. Just this week, I've had 2 of my very close friends tell me that they were surprised when they got a doctor that really cared about what they were dealing with. And they are not chronically ill, they are very normal, able-bodied people, and they were like, "I have been trying to find answers for my gut health or my skin that I didn't realize that what it would feel like when a doctor believed me." And it sucks, right? It sucks that as women, like, we are taught that, like, we're overreacting, we're being emotional, it has to do with our menstrual cycle or whatever. It just sucks that that is like what society has ingrained in our heads to the point where when we are just seeking an answer, like I'm coughing all the time, I need to know why. It's just allergies, right? Like it's just like you need to eat better or whatever. And it just sucks that that's what we tell ourselves. And then we accept the mediocre care and the mediocre testing and the mediocre doctors that don't care to dive deeper or to really seek the answers that we're asking them for. And it's heartbreaking. It's heartbreaking to get mediocre doctors when you are experiencing enough of an issue that you went to the doctor in the first place. Medical gaslighting is unfortunately a very big reality of what people with a chronic illness or even people without a chronic illness go through all the time. And it's unfortunate that is like a real thing. My friend, Alana Jacqueline, wrote an entire book about medical gaslighting. And if you haven't read it, I highly recommend you read it just to look at the stories that people are telling. I will link it in the show notes, but it is a great representation of what people are really going through in the system. And I have so many friends that do not have a chronic illness that have all dealt with the same things. And it's so sad that you end up seeing these doctors, you pay all of this money, and all you get is it's probably your anxiety. It's really crushing to your spirit when you have gotten to the point where you want to get answers and you go and you just get dismissed. I have been so fortunate to find great doctors now, but I have had really bad care. I am so thankful for Dr. Moss and Dr. Hontress, and I am so thankful that they are such good examples of what the medical system can look like when it works well and when it works together. They work as a team, even though one is in Colorado and one is in Florida. And I'm so thankful that they are humble and that they're kind and that they're really listening to me when I talk. And I'm thankful that they don't mind that I get a second opinion. They actually encourage me to ask the other about what they think. They often talk to each other anyway, which is really cool to see doctors collaborating instead of competing. And I have been so fortunate to find doctors like that. But I know that's not everybody's reality, and I know that's not everybody's situation, and that is so hard, especially when you have a rare disease, especially when you have an invisible illness and that you feel like you are just constantly fighting for your life in your own body every day, and then to also have to turn around and fight medical professionals for accurate care. So, if you are looking for a doctor, if you're looking for a good team, I encourage you to continue to seek out specialized doctors, to continue to seek out accredited centers, continue to seek out centers of excellence for your specific disease or your specific chronic illness. I encourage you that if you do not vibe with a doctor, that if you do not understand what a doctor is saying to you, that you ask more questions or that you ask for a second opinion or that you ask if you can have a little more information so that you can do your own research. Doctors who are doing their job and that are good at what they're doing will have no problem giving you answers or giving you more resources to look up or waiting for you to go get a second opinion. It's really a sign of a great doctor that says, "Yes, I am confident in myself enough for you to go get a second opinion, or for me to take that." I have never been more trusting of a doctor that says, "Yeah, maybe I don't know it all." And I'm thankful that my doctors are collaborative doctors. They collaborate with me, they collaborate with each other, and that gives me the best opportunity to get the best care. And that leads me into what I wanted to announce. So, I started this podcast. Obviously, I am happy to sit here and talk to you about the things that I've experienced, but I do find that there will be a lot of benefit in you guys hearing from other patients and caregivers and doctors. And so next week, you're going to hear from me and my doctor, Dr. Hountress from Colorado. And I'm so excited for you guys to get to hear him and get to see me interact with him. He is amazing. I'm super excited that he's going to be a reoccurring guest on the show and he can speak to a doctor's perspective on everything that I talk about. We're recording this week and I'm so excited for you guys to hear it next week. I want to round this episode out by saying If you are dealing with medical gaslighting, if you have dealt with medical gaslighting and you are saying things to yourself that are not kind, I want you to know that your opinions are valid, your experience is valid. And if you get those surveys from your doctor or from your clinic, fill those surveys out. Say things with your chest and say, hey, I did not appreciate when you said this or when the doctor did this, because your opinions could help somebody else and your opinions could also change somebody else's experience by just filling out a simple survey, by telling somebody when they call and say, hey, like I had this experience and it was really difficult for me. You are not a squeaky wheel or a difficult patient just because you're telling somebody what you experienced. I trust you. I believe you. And I hope that you will trust and believe yourself in situations where you're telling yourself, maybe it's me, because it's not always you. Sometimes it is the doctor. Sometimes it is the nurse. Sometimes it is somebody being rude to you, even though they are supposed to be helping you. I would encourage you to get a second opinion, find a new doctor if you don't like your current doctor. There is always somebody else out there, and that is the beauty of being in the American medical system, where you can choose your doctor and you can choose to not go to that doctor. So, thank you for listening. I love you guys, and I will see you guys next week.